everyone. I'm glad you're here. Thank you very much for joining me. It is Thursday, August 15th, 2024. I really hope this doesn't get flagged by YouTube. Please share, just in case it does get flagged and taken down. Just over a year after the last Mpox outbreak was deemed to be no longer an emergency, the World Health Organization, WHO, has once again sounded its highest alarm, declaring Central Africa Mpox surge a public health emergency of international concern. Mpox, formerly known as monkeypox, is a rare and potentially serious disease caused by the Mpox virus. Mpox does not spread easily between people. Human-to-human transmission occurs through close contact with infectious material from skin lesions of an infected person, though respiratory droplets in prolonged face-to-face contact and through fomites. Fomites are a group of viruses caused by the upper respiratory tract and eye infections. Coronaviruses are a common virus that causes the upper respiratory infection in both animals and humans. Droplets caused by sneezing and coughing can spread the germs onto surfaces either through the droplet release from the sneeze or cough itself, or through germs from the sneeze or cough getting onto the hands, which then comes in contact with your body. Fomites can be found on countertops, handrails, doorknobs, light switches, mobile phone, and clothing. Mpox, formerly known as monkeypox, was made a PHEIC, which is the abbreviation for Public Health Emergency of International Concern, in July of 2022, as it spread rapidly across a range of countries where it hadn't been reported before. Despite that emergency ending in May of 2023, reported infections increased significantly, and the number tallied so far this year already exceeds the 2023 totals, with more than 15,600 cases and over 530 deaths. Is this going to be the cause for the next lockdown before the election? That way they can have more control over the mail-in ballots? I don't know. According to retired General of the U.S. Army, Michael Flynn, who was on Redacted yesterday, he said that's what happened during the 2020 election. He was the National Security Advisor for the first 22 days of the Trump administration. Many people think the next lockdown might be from H5N1, the bird flu that's currently spreading. We haven't heard too much about that with the outbreak of the cows. So what is the recent situation? Why have things changed with the Mpox? They're saying because vaccines haven't been widely available where they are needed the most. The limited awareness of Mpox and lack of knowledge about practices for prevention among health workers and among key populations such as sex workers or men who have sex with men in the country exacerbates their risk for Mpox. The WHO's first Mpox PHEIC announcement came after cases were reported outside of Africa, including in the US, UK, and Australia. This led to the countries ramping up access to smallpox vaccine that worked against the related Mpox virus. Evidently, there's some connection and relation to smallpox. In Italy, it is believed that there was a man to be the first diagnosed person with monkeypox, COVID, and HIV all at the same time. Experts say it's very rare to get COVID and monkeypox at the same time, and there is not a known documented instance for a person being diagnosed with all three infections at once. The 36-year-old Italian man recently returned from a 5-day trip to Spain, and that was in June of 2022, according to the study that was published in the Journal of Infections. More than a week after his return, he developed symptoms that included a fever, sore throat, and headache. He also started noticing an unusual rash on his arms and body. After he was admitted to the Italian hospital, he was diagnosed with both COVID-19 and monkeypox. Additional testings also revealed the presence of HIV. It is not clear exactly when he contracted each of the viruses, but it is believed to be within a relatively recent time period for all three. The study's author also said the man had been treated for syphilis in 2019. He was vaccinated against COVID-19 and had previously contracted that virus in January of 2022. He was treated for the Mpox and COVID and will have to take a lifetime of a combination of antiviral therapy for the HIV. Efforts that they did back in 2022 help cases to subside of monkeypox in these parts of the world. But in the Democratic Republic of the Congo, DRC, the epicenter of both outbreaks, vaccines were largely unavailable due to a lack of funding and other countries not donating to them, allowing the outbreak to persist. This meant the virus could spread, mutate, and evolve, which resulted in the emergence of a new version, or clade of Mpox. There are two main types of Mpox, clade 1 and clade 2. While these both circulate in Central and West Africa, a subtype of clade 2 drove the global outbreak in 2022. While the recent ongoing surge is due to the subtype of clade 1 called clade LB, it may have emerged even if vaccine efforts have been better, said a professor at the University of Oxford. Clade 2 is a type of virus that caused the global outbreak that began in 2022. Infections from clade 2 Mpox are less severe. More than 99.9% of the people that catch it survive. Clade 2 is an epidemic in West Africa. Clade 1 causes more severe illness and death. Some outbreaks have killed up to 10% of the people who get sick. Although more recent outbreaks have had lower death rates, clade 1 is an epidemic to Central Africa. Widespread vaccination in epidemic countries would have undoubtedly have helped control clade 1, reducing the risk of its evolving. There is no doubt that if we had more vaccines, there'd be less clade 1, said the professor. According to Jason Zucker at Columbia University in New York, he said it's always hard to say what would happen if mutations are a number game. The more infections you have, the greater the chance of a meaningful mutation. If we were able to vaccinate more people in the DRC over the past 1 or 2 years, it's likely we would have seen less cases, less spread, and I suspect not end up with another public health emergency of international concern. With all these people migrating, and look how many have recently come into the UK. It's a great concern. Since January of 2023, the Democratic Republic of Congo has reported more than 22,000 suspects Mpox cases and more than 1,200 deaths. So what are the risks here in the United States? No cases of clade 1 Mpox have been reported outside of Central and Eastern Africa at this time, according to the CDC. They also say the risk to the general public in the United States from the type of Mpox circulating in the DRC is very low. The CDC also said it has made the assessment due to the limited number of travelers and no direct commercial flights from the DRC or its neighboring countries to the United States. The risk might change as more information becomes available or if cases appear outside Central and Eastern Africa. People in the United States who have already had Mpox or are fully vaccinated should be protected against the type of Mpox spreading in the DRC and neighboring countries. Mpox needs close or intimate contact to spread, so casual contact, like that you might have during travel, is not likely to cause the disease to spread. The best protection against Mpox is 2 doses of the vaccine, which they call JYNNEOS, if you're eligible. So it must be some kind of limited vaccine that you have to have certain requirements to get it. But I recently found an article that was on Newsweek. They said that Mpox has been detected in the wastewaters of the United States sewer systems after the virus was declared a public health emergency by the African Centers for Disease Control and Prevention as a more deadly strain spread across the continent. Wastewater surveillance systems are in place across the U.S. to detect Mpox activity and track its spread through the community. They started all that back during the time of COVID. Started testing the wastewater to look for different diseases. Here's a map. I don't know how well you can see it, but it shows all the areas that Mpox has been detected in the wastewater treatment plants here in the United States. Try and make this bigger and pull it over here. We got the state of Washington, California, Texas. There's actually 2 places here in South Dakota. Illinois, Maine, New York, Pennsylvania. Let me pull this up. And Florida, Louisiana, Tennessee, Nebraska, Kansas. This is where it was all recently detected between July 10th and August 6th of this year. I thought it was interesting, the locations in Missouri and in Michigan that was showing the spots where it's actually been detected. Let me pull it over some more. Maine. Look at Maine. I also found a map showing the percentage of people with Mpox. Now this is from 2022, and it's per 100,000 people for the detection. California 14 to 23%, Illinois 11 to 18%. Let me bring this down. Florida 13.2%. Georgia, that really surprised me, 18.65%. Now again, this is for 2022. The lowest areas looks like Iowa, 0.86 per 100,000 people. South Dakota, 0.34. Those are probably the lowest number of states. Vermont, 0.48. In another area that was high, that would have been Nevada at 10.26%. Why is Georgia so high? I don't know. And New York, I guess New York's probably number 1. Well, we all know why it's number 1. 21.51. People. That's probably the highest number in New York. They also got the outbreak of tuberculosis there. And I also believe in Chicago, Illinois, they got the outbreak of tuberculosis, there. So far this year, there's been 1,122 cases of Clade 2 Mpox has been reported this year, according to the CDC. Most of the new cases have been reported in people in higher risk groups who have not received 2 doses of the Mpox vaccine. Now, the Clade 2 Mpox is less severe. More than 99.9% of the people that contract it do survive. Although cases of Mpox are not life-threatening, some people may be more likely to get severely ill, including people with a severely weakened immune system, children under the age of 1, people with a history of eczema. Now that really surprised me. My granddaughter has eczema and she's got to get shots and all kinds of medications. She's got it so bad on her, mostly on her hands. And also it's also a danger for people who are pregnant. There are several ways you can protect yourself and others from Mpox, including avoiding close skin-to-skin contact with people who have a rash that looks like Mpox, or animals that may carry the Mpox virus. I don't know what those animals would be. I believe it was first discovered in a research center for monkeys. Learning steps you can take to lower your risk of Mpox during sex or at social gatherings. And of course, they're telling everyone to get vaccinated. You can check with your healthcare provider to find out if the Mpox vaccine is recommended to you, but they're saying that you have to meet a certain criteria. Mpox symptoms. People with Mpox often get a rash that may be located on hands, feet, chest, and face, or mouth, or near the genitals, including the penis, testicles, vagina, anus, etc. The incubation period is anywhere from 3 to 17 days. During this time, a person does not have symptoms, may feel fine. You can still spread it even though you're not showing any symptoms. The rash will go through several stages, including scabs before healing. The rash can initially look like pimples or blisters and may be painful or itchy. Other symptoms of Mpox can include a fever, chills, swollen lymph nodes, exhaustion, muscle aches and backaches, headaches, respiratory symptoms such as a sore throat, nasal congestion, or cough. And you may experience all or only a few of those symptoms. So how long do the symptoms last? Typically, Mpox symptoms start within 21 days of exposure to the virus. If you have a flu-like symptom, you may likely develop a rash 1 to 2 days later. If you have symptoms like a rash, definitely get to the healthcare provider. Go see your doctor. New data shows that some people can spread the Mpox to others from 1 to 4 days before their symptoms appear. It's not clear how many people this has affected during the ongoing global outbreak that began in 2022. There is currently no evidence showing that people who never had symptoms have spread the virus to someone else. And of course, the CDC says they're going to continue to monitor the latest information about how Mpox spreads. I don't know, what are your thoughts? I'm not going to fall for it again, just like I did in 2020. Anyways, put your comments down below. Thank you very much for watching. Please like, share, and subscribe, and I'll talk to you later. God bless you. Bye.